Welcome to the Wellness Health Services Health Talks. As I always say, these health talks are for general information, for medical treatment and the medical evaluation. Always see your health provider. Today our talk will be on sleep disorders, and specifically we will be handling insomnia. Insomnia is a situation whereby an individual has difficulty getting to sleep. The difficulty in sleep could be difficult to get into sleep, or there could be difficult getting to sleep after awakening at night, or waking up earlier than you expected. Usually we talk about the rule of 30s, which implies that you stay in bed for 30 minutes before you get to sleep. You take more than 30 minutes before you are able to get to catch up with the sleep after you awake, and waking up 30 minutes earlier than expected. So usually sleeping problems can be either acute or it can be chronic. We talk of acute insomnia if the symptoms have lasted for less than a month and the symptoms of sleep disturbance must be there for more than 1 month. For chronic insomnia, the problem of sleep must be there for more than 3 months with more than 3 days of sleep disturbance. Usually you have sleep disturbance which is accompanied by general body symptoms during the day, whereby you have sleepiness during the day, you have general body weakness, you have a feeling of irritability and difficulty in concentration. So if you have this kind of problem, then you have a sleep disorder. The causes can be either medical, they can be psychological, or they can be behavioral or drug induced. The medical problems are some of the medical conditions like heart failure, diseases like asthma, sleep apnea can cause sleep problems. You have psychological and psychiatric problems like anxiety disorders, psychosis, schizophrenia, and you can also have behavioral problems whereby individuals have problems with sleep because of their behaviors. Then you have drug induced, and some of the drugs that are used for treatment of some of the medical problems can make someone to have problems with sleep. So some of these factors will lead someone, if you're using some of these drugs, then you have problems getting into sleep, or they can make you wake up earlier than usual. So how do we manage the treatment, the problems of sleep disorder? One is what we call sleep hygiene. Sleep hygiene means that you have a specific time of going to bed, and also a specific time of getting up consistently throughout the week. Then removing distractions from your bedroom, things like writing, avoiding use of phone or electronics in the bedroom. Then also avoiding some stimulants like coffee or exercises before going to bed. So those are some of the things that you can do. And also knowing that when you get to bed, if you have stayed for more than 30 minutes and you are not getting sleep, then the best thing is to get out of the bedroom and go do something else until you get sleepy. Then the other thing that you can do if you have this kind of problems is exercises. You try to avoid exercises 3 hours before sleep, but during the day when you have time you can exercise. And we usually encourage that you have at least 30 minutes for more than 3 days in a week. This will help to improve your sleep behavior. Then diet, eating healthy diet which is rich in vegetables and fruits will also help you in your sleep. And avoid heavy meals just before bedtime, especially we advise that 3 hours before going to bed you should not have a very heavy meal so that you don't have a problem. Then of course if the problems persist, then there is the medical treatment whereby you're given some medication which can help to help you sustain your sleep, and also wake up feeling relaxed. There are different classes of medicines that are used for sleep depending on the cause of the problem, and also those who have medical or psychiatric problems, then management of the underlying medical problems will help the individuals to get into sleep. So in summary, insomnia is a condition characterized by either difficulty getting in sleep or waking up earlier than usual for more than 3 days in a week, which lasts for more than a month, and it comes with associated symptoms during the day due to lack of adequate sleep. It can be treated with sleep hygiene, exercises, and also use of medications to help with the sleep, and the treatment of other underlying conditions that might be prevalent. Thank you very much for listening to me.